Hello, my name is Devin Bally, and I'm going to be going over the FVC maneuver using a spirometer for the pediatric population of children aged 12 through 18. Now, a lot of times we think that this age might be a little bit easier to work with than maybe a younger population, but depending on what you're comfortable with and the type of patients you may have for the pediatric population, it might be a lot more difficult than what you might think. So I'm going to be going over different ways you can use, different techniques you can use, as well as performing an FVC maneuver on a child. So FVC maneuvers are really, really great tools, and they're really awesome. First off, because you can use them anywhere. It can be in a hospital, it can be in a clinic, it can be in a PFT lab. And once you're trained on them, they're really, really easy to do. They're really important in classifying disease progression, but also catching on early detection of various disease processes that have to do with the lungs. So spirometry is the term given to the basic lung function test that pretty much measures the amount of air that's inspired and expired. With this spirometry test that we do, the FVC maneuver, we are looking at our volume, our time, and our flow. And knowing how to read these loops are really, really important in classifying the disease process that this patient might have, or at what stage of the process they are at currently. Before I talk about the different teaching techniques that I would use for a population of pediatrics aged 12 to 18, we're going to talk about getting the test ready. So it's really, really simple. The first thing you need to do is you need to find your spirometer. This is one of the older ones, but it's still very, very easy to use. In addition, you're going to want your nose clips. I know in some of our pediatric population, we don't really need to use them. Obviously, we want to if they can, but coming in knowing that our population is age 12 to 18, we are going to treat this population like they can use nose clips. In addition, you want to get the alcohol wipes. You want to make sure the equipment's clean. And also you want to get your spirometer or your spirette to put into the spirometer. And it will be sealed. This one is not out of practice, but it will be sealed and a one-time use kind of thing. And yeah. So before we even think about performing this test on our patient, we should really look at their electronic medical record to see if we can spot any kind of contraindications for our patient. Because if they have even just one contraindication, we can't proceed with the testing, and we have to find an alternative. Just to name a few of the contraindications we're looking out for, it would be hemoptysis. We also don't want to do this on a patient with a pneumothorax. Anybody with high ICPs, recent eye surgery, a history of nausea or vomiting. Also, any kind of abdominal or chest surgery, it wouldn't be pleasant to do on. So, also, if you're hemodynamically unstable, we don't want to be performing this test on them. So once our patient passes that initial screening for any kind of contraindications, we can actually progress forward with the testing. So with this patient population, sometimes it's better to not have a parent in the room, just because we don't want the parent to antagonize or overstimulate our patient. And a lot of times this patient age, being that they're middle school and high school, they feel a sense of independence, and they feel more respected when you treat them as someone that can handle what you're trying to give to them. So if the parent gives permission for them to go back and do the FVC maneuver without them, that would be the ideal scenario. But if the parent would prefer to be there, it's completely fine too. It won't affect the test from the patient. It was just more for patient comfort. So once we are ready and the patient comes back, whether with his parent or guardian or without, we want to bring them in. Obviously, we want to wash our hands or gel in and put on our gloves. Depending on where you're at and what facility you're at, you're most likely wearing a surgical mask already. So a mask and gloves would be the ideal PPE to be wearing when you're doing an FVC maneuver. Once you're ready, you're going to talk through the database for this to create a new patient profile. It's going to ask for their ID number, their name, their age, and their weight. It's super important to get these as accurate as possible. So if you have a recent scale weight for this patient, we want to use that, and also their height. So once we get the machine going and we ask the patient just the basic questions, and we're pretty much confirming either with the guardian or based off of the what the patient's saying and off the record, but just things like their ethnicity, their gender, their height, their weight, their name, and all of that. In addition, it's going to ask if they are a smoker. And whenever we word this, we want to make sure we're wording it correctly. Not just saying, do you smoke? You want to be more specific. Have you ever smoked, or are you a current smoker? Is probably a better way to ask than just saying, do you smoke? In addition to that question, they're going to ask if they have asthma. So once we get that going, we're going to give the patient not too much information. They're already in a new place. They probably don't even understand why we're doing this test. We can fill them in and give them just basic information. We don't want to overstimulate them and make them anxious or worried because they might not know some of the things we're saying. They might not understand it. And because of that, they can either shut down or just become anxious, and we can't get the consistency we need in our testing. Basically, we want reproducibility. And we can't do that if the patient is uncomfortable. So it is super important to not give too much information, but give the right amount to keep your patient comfortable, to keep your patient trusting you, and also just to give them an idea of what's going to happen. Next, we'll be using the teach back method. Basically, we'll just give them basic instructions on how to perform this test effectively and let them know that we don't want to do this more than 3 times or more than we have to. Obviously, 3 is what we're going for. We don't want to do anything more than 8. That's not good. If we get to 8 and we're not getting the reproducibility that we need, we probably need to terminate the test and reschedule. But like I said, using the teach back method with this age group is really, really important, but also using positive feedback and just encouragement throughout, but not being too overly excited, but just being the right amount for this age group. You don't want to come off like treating them like a kid because, like I said, depending on their age level, they don't want to feel like a kid. They want to feel that independence and all of that. So we'll give them as much as they can handle. Now that we've entered everything into our spirometer, it's now time to use the teach back method with our patient. Alrighty, so what we're going to do is I'm going to have you sit on the chair, feet as close to the ground as possible and as far off. Yes, awesome. So what you're going to do basically is you're going to take a really, really big deep breath in until you feel like you're going to start shaking. And once you hit that point, you're going to force all that air out at one time, and you're going to go for 6 seconds. 6 seconds might sound crazy. Even if you feel like nothing's coming out, keep breathing out, don't breathe in. Sound good?
Yes.
So teach back, can you tell me what we're doing?
So I'm gonna take a really big deep breath in. I might feel like I'm shaking, and then I'm gonna basically take all that air out, blow it out for 6 seconds, and just hold it.
Yes, perfect. So these little markings are for your teeth. Don't bite too hard, but that's where your mouth's gonna go. Big deep breath in, deep breath in, deep breath in, deep breath in, deep breath in. When you feel like you're about to shake, blow it up. Hard, 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 keep going. So if y'all saw from that, she wasn't breathing out hard enough and she didn't breathe out for long enough. So the next thing I would do was tell her how great she did on it and how we can do it better so we can get a usable loop and get a repeatable usable loop.